Hi, I am Dr. Sridhar Reddy from Happy Dental Hospital. Today I am going to speak about various brushing techniques. Why brushing techniques? Not just brushing techniques. Going to a dentist, having root canal treatment, having gum treatments, having dental cavities is a major problem to most people. Today I'll tell you a secret where you won't need dental cavities, gum diseases, bleeding gums. All these can be arrested by simple techniques and some secrets which usually a dentist won't tell to anybody. So what you should do? You should be brushing twice a day, first thing. So we know that most of the people don't brush in the nights. Everybody prefer brushing only in the morning, but most people don't brush in the nights. But brushing in the nights is extremely important because your saliva in the nights is stagnant. It won't move. So as you know, running water is never a breeding point for any bacteria or virus or mosquitoes or anything. But stagnant water always attracts every bad thing into it. In the same way, during the day, we'll be talking all the day. So our saliva will be moving all around our mouth, flushing our teeth, cleaning it all the time. But in the nights when you sleep, your saliva is stagnant. So that becomes a playground for your bacteria to come invade your teeth, cause dental caries, form plaque and all gum diseases, all these things. The reason is not brushing in the nights. So that is the important thing. And then I'll tell you about brushing the teeth. Brushing the teeth, we commonly see, I'll tell you a simple example. Brushing the teeth with this, suppose 90% of households in India, they clean their combs with a old toothbrush. So, they won't clean it like this. If they clean it like this, it won't get clean. Same way, brushing your teeth like this will never clean your teeth. So, how do you clean your comb? You just place it on the teeth, move it a little, see to that the bristles goes inside the comb, then take it out. Same principle you can follow for brushing your teeth. Just place the brush gently at the teeth gums junction, slowly move it like massaging that area, come down. Same thing. So upper teeth, brush it downwards, lower teeth, brush it upwards. That way you can clean in between the teeth. In the same way, inside, below the tongue. Extremely important. This brushing techniques, if you follow morning and night, keep your teeth clean throughout the day, your teeth will be perfectly normal for a very long time and your visits to the dentist will be lot reduced and your dentist bills comes down no way. And one more thing, toothbrush. There are various types of toothbrushes in the market. Which toothbrush should you use? You have rhomboid shaped, you have rectangle shaped, triangle shaped, various types of toothbrushes. Which toothbrush you should use? The one which you are very comfortable for holding, one which bristles won't harm your gums, one which goes to all parts of your teeth. Whichever toothbrush it is, if you are comfortable with this toothbrush, you can go ahead using it. Electronic brushing. Your teeth doesn't know whether you are using a electronic brush or a manual brush. Whichever brush you use, you follow the proper technique, your teeth will be perfectly normal and clean. Yeah. Now coming to toothpastes. There are various types of toothpaste in the market. You go into a supermarket today, you see thousands of toothpaste. And we don't know which toothpaste who should be using. I don't know which toothpaste. Most commonly, my patients who come to my clinic, they always ask me which toothpaste to use, sir. So that is a big confusion. So out of thousands of pastes, what I have done for you today is, I'll divide them into 4 or 5 groups. So you select which group you belong to and take the toothpaste. All these toothpaste, all the thousands of toothpaste can be divided into 4 or 5 groups. So let's see those groups. So first group is kids toothpaste. Kids toothpaste, you have subdivisions, 3 more divisions in a kids toothpaste. Kids toothpaste can be below 2 years, you have kids toothpaste. 3 to 5 years, you have another type of kids toothpaste. Above 6 years, you have another type of kids toothpaste. Why these differences in kids toothpaste means, as the age increases, the amount of fluoride added in the toothpaste keep increasing. For example, below 2 years kids, toothpaste you don't have any fluoride at all. But 3 to 5 years you have little bit of fluoride, and above 6 years you have certain amount of fluoride required as per the government regulations. Then these are the things for toothpaste for kids. Then next division. So you decide which category your kid belongs to and give him that toothpaste, and it will be good for him. Then let's see other category, more numbers, commercial toothpaste. In commercial toothpaste, you have toothpaste with the charcoal, you have toothpaste with salt, you have toothpaste saying they are whitening toothpaste. You have a lot of hell of brands in commercial toothpaste. What these toothpaste do is, they are very good. They have little more abrasive content than the regular toothpaste. So they are good in clearing the stains on your teeth. Some stains can be properly cleaned with this toothpaste. But the problem here is, you have to be extremely gentle while using this toothpaste. Use a soft brush. Brush in proper technique. If you don't use proper technique and brush this toothpaste, use this toothpaste and brush in a very hard way, your teeth will get abraded, worn away. Those who have teeth sensitivity because of teeth erosion or abrasion, better not use this toothpaste. One more thing is teeth whitening. Whitening toothpaste now you are seeing in the market. Whitening toothpaste, they usually contain 2 to 3% of peroxide in them. In our dental office, we use 35% peroxide. We place it on the tooth, use light, use laser, try every trick we know we try on the tooth. Still, the shade improved with our whitening procedures is hardly one shade. Then how do you think this toothpaste, which has around 2% of peroxide, will make your teeth white in 2 minutes? It won't. So don't believe such things. These toothpastes are good, they clear your stains, they have good abrasive content, you can use them, but don't think too much about them. Then coming to Ayurvedic toothpaste, you have Ayurvedic, natural, herbal, whatever you call them. These toothpastes, they are not completely natural. The people believe that these toothpastes have complete natural toothpaste, they don't have any chemicals. People believe that. But believe me, you cannot make a toothpaste without chemicals. Be it Yogi Swami's toothpaste or Sadhguru's toothpaste, anybody's toothpaste, it needs to have chemicals to make the toothpaste in that form. So you have to use it. But these herbal toothpaste, you have one good thing is, they have very good taste, natural taste, and you know, lavang, this clove, camphor, these things, when you place on a tooth where you have pain, they relieve pain because they act as counter irritants. For example, if you use Jendu balm for your headache, your pain will be relieved. The same way these toothpaste will relieve your tooth pain. So that is not treatment, that is only temporary relief. You have to remember that. So when you use this toothpaste, don't think your disease is gone. Don't think your gum bleeding is stopped completely. The disease is there inside. So when you use this toothpaste and think your problem is solved, you are into a big mess. These problems will continue, these problems will increase, and your treatment later will be much bigger. So visit your dentist when you have a problem like this. Then coming to medicated toothpaste. Medicated toothpaste, sensitive toothpaste, or your teeth feeling sensitive while drinking cold water, sweets, all these things. These ads you keep seeing nowadays very often. So these toothpaste, all these medicated toothpaste, their key ingredient is potassium nitrate, salt. This is salt. What this potassium nitrate does is, it seals the dentinal tubules. When the enamel is eroded, you have sensitivity because of dentin exposed. These salt, potassium nitrate salt, seals that dentin area and relieves your teeth sensitivity. But what you have to remember in this medicated toothpaste is, what these commercials won't tell you is, your teeth sensitivity is not only because of teeth wearing away. Teeth sensitivity can be because of teeth wearing away, it can be because of cavities in your teeth, it can be because of gum disease. So teeth sensitivity can be because of all these problems. So if you are using your desensitizing toothpaste and you feel your problem is solved, you are going into a problem. Because you have to visit a dentist and have the treatment done, only then you can continue using this toothpaste. Then finally, these are 4 categories I have told you. One more category, this is the 5th category. This is a new toothpaste. This is a herbal toothpaste or Ayurvedic toothpaste with potassium nitrate in it. So why this toothpaste has become popular in a very short time? This is very popular on Amazon. Amazon, I don't know why it's so popular on Amazon. It's the choice of Amazon. Why this toothpaste is so popular is it has excellent taste because it's an Ayurvedic toothpaste. It relieves tooth pain, it relieves bleeding gums, it relieves bad breath. It is excellent in relieving sensitivity because it has potassium nitrate in it. So using this toothpaste is really causing a problem to dentists. What the problem is, you are using this toothpaste, you are not visiting the dentist for your problem. The problem is getting worse, and finally once you go to a dentist, the dentist will be telling you go for a root canal treatment or an implant. So when you use this toothpaste, they are very good. I would really suggest you to use any of this toothpaste, but be careful when you use this toothpaste. Use them with caution, go to a dentist before you use when you have a dental problem. Yeah, I have some facts of toothbrush for you. So toothbrush should never be placed in your washroom because the commode, whenever you flush your commode, the droplets from your commode will come and fall on your toothbrush bristles. This is one thing you have to remember. Another thing is toothbrush cap for the toothbrush. You see nowadays you have caps, special protection caps for toothbrush bristles, and that is not really good because a moist toothbrush, when it's covered with a cap, what happens is there is high chance of bacteria and fungal infections coming up onto the toothbrush. One more thing is every 3 months or 4 months you have to change your toothbrush. If not, in between these 2-3 months you get fever, cold, or even if you get COVID-19, you have to change your toothbrush. So sharing is caring, but not in relation to toothbrushes. When you put your toothbrushes, don't see to that your family toothbrushes won't fall on each other, all the toothbrushes one over the other, so that one infection from one person can spread to the other person. And one more thing is, you see the toothpaste companies, they show you ads of toothpaste being all over the bristles. They put a big line of toothpaste. Actually, that is not required. Toothpaste required is for adults above 6 years. You need peanut size of toothpaste. Below 6 years kids, you need only rice grain size of toothpaste. Suppose, and placing the toothpaste on your toothbrush is also very important. You are not supposed to paste the toothpaste onto the bristles. You should see to that the toothpaste goes into the bristles. Just see this. I am pushing the toothpaste into the bristles. Just peanut sized into the bristles. What happens is, if you do this, the paste will get stuck to the bristles all the time as long as you keep brushing your teeth. If not, if it is on the bristles, when you try to put it in your mouth, the paste falls down into the wash basin, you won't be brushing anything with the toothpaste. Neem plants stick, neem stick, meswak stick. You see people trying to use these things from ancient days. They are very good for people of those days because the kind of foods they eat, the kind of quality of foods they were taking, they used to take more of raw foods. They used to bite away these sugar canes, all these things they used to eat. But today's, our food habits, the way what we eat more of refined sugars, more of refined carbohydrates, and such type of foods. We need to use soft brushes, simple toothpaste to clean our teeth, not these rough items like coal, charcoal, so this thing, salt and neem stick. These things will try to abrade your teeth. They are good if you want to eat them, but don't brush your teeth with them. Use a toothpaste and toothbrush.